So the next two speakers I'd love to introduce, Dr. Natalie Coburn is a surgical oncologist at Sunnybrook Odette Cancer Center and professor of surgery at the University of Toronto. So her specialties include upper GI, including stomach cancer, as well as the liver, pancreas, and bile duct cancers. She's a clinical lead in patient-reported outcomes and symptom management at the Cancer Care Ontario. She holds the Sheriff and Mary Lou Hanna Chair in Surgical Oncology Research. And she works with Monica Yuen, who is a Master of Public Health student at the University of Toronto, also at Sunnybrook Cancer Hospital. She works with Natalie Coburn and the Canadian Gastric Cancer Association, and also My Gut Feeling. And together they are a dynamic duo that are part of this integral project on nutrition. So please help me welcome them.
Thank you. Thanks, Katie. Thanks, Teresa. Thank you for that kind introduction. I'm really happy to be here and speaking about this, and I'm going to talk a little bit about how we got to this point. And so the grant is called Integral, which is why we keep saying that word. And it's a discussion of nutrition. And this is a Canadian Cancer Society grant. And if you ever wonder if what you're doing matters, it does. So this is because of patient advocacy that there was specific grants that were created within the Canadian Cancer Society to look at gastric cancer and esophageal cancer and other rare cancers. So it was because of the group here, and especially Katie and Teresa, who advocated to the Canadian Cancer Society to make this money. And Dr. Ferry is going to talk about other ways that he's spending that money to improve outcomes as well. And I'm really pleased to be standing here with Monica. Monica is one of our master's students, but also a caregiver for her mother who had gastric cancer. And she came to our group saying, I want to help. How can I help? And so it's really my privilege to be standing here today. So I will see if I can advance the slides. Which button do I push? That one. There we go. All right, go.
And I would also like to add on, as a caregiver to my mother who was diagnosed with stage 4 gastric cancer. Unfortunately, she passed away a few years ago. But I really would like to say it's an honor to be here and standing here. And I would like to say thank you to Teresa and Katie for this opportunity. It feels like a full circle moment to me. In a way, I just wish during my journey I knew about like My Gut Feeling and other patient advocacy organizations. Okay, so I'm going to get started. I think Denise did a really great job in explaining some of the challenges of nutrition with gastric cancer. As we all know, nutrition and diet are two of the biggest challenges that gastric cancer patients face on a daily basis. Up to 85% of patients experience dietary difficulties throughout their cancer journey, and roughly about 15% of patients may experience weight loss greater than 10% within the first 6 months of diagnosis. And just briefly, as Denise, again, did a really great job, given that this is cancer within the stomach, which is one of the main organs that affect the way we digest and break down foods, and also the different combinations of treatments, which can be really harsh on the body. This could lead to nutritional issues such as abdominal pain, muscle weight loss, the blockage of bowels, malabsorptions, micronutrient deficiencies in certain vitamins such as vitamin B12, D, calcium, copper folate, low bone density, and it really affects the way patients might tolerate chemotherapy or other types of treatments.
So we picked this slide because this is really what I feel like I've heard from this group over and over, is that there's a dearth of information. People feel a little bit lost. There's not a lot of advocacy for dietitians in many cancer centers, and there's not a lot of guidance. And when you turn to your family physician and say, what should I do? The family physician also doesn't have a lot to go on. And if you're a family physician or someone outside the cancer center, you may be taking care of a patient with gastric cancer once every 5 years or once every 10 years. So very challenging for those practitioners to know what to advise people who have a gastrectomy or who are dealing with gastric cancer. And so our aim was to improve patient quality of life through multimodal determination of best practices and nutritional support. And the way we came to this is because Teresa emailed me and said, there's a grant. It's specialized in gastric cancer. What are you doing as a researcher to do better here? And how are you going to improve? And how are we going to work together? And so we brought the team together, and it was us and Dr. Bresden and Dr. Elamova and many patients. And I have ideas about what I want to do and think about chemotherapy and quality of surgery. And the patients said, we need to talk about nutrition because this is really the baseline problem that all of us are struggling with on a daily basis. So we brought together a team of medical oncologists, surgical oncologists, dietitians, patients, caregivers, and really I'm very proud of this team. It's representing surgeons and medical oncologists from across the country, as well as patients and caregivers from across the country. And so from the very beginning of this research project, we've had a very strong team approach, and you'll see it every step of the way. We're trying to integrate people from across the country and at all levels.
Okay, so going into our project, the first objective is conducting a scoping review, and it's really to just identify what is out there in the literature and identify the current knowledge gaps regarding nutritional and micronutrients assessment and support for patients who are receiving gastrectomy. And so far, our team has conducted a comprehensive search across 4 electronic databases, and we've identified 15,000 abstracts, which is quite a lot. And so currently we're going through each abstract and we're screening and seeing what we could do, what kind of data that we can extract. And I would like to emphasize that this objective is led by our Manitoba team. So Dr. Farhana Sharif, who's a surgical oncologist in Winnipeg, Vibhav Gupta, who's I believe is a thoracic surgeon, and Denise Gabrielson, and our patient lead, Lena Miranda.
So the next thing we're doing is a needs assessment survey, and we're actually going to reach out to all of you shortly about this. So we want to hear from you. We want to hear what you want in these guidelines. What issues do we need to address? And so this is a very qualitative survey. It basically says, what do you wish you had known when you came into this? What do you wish practitioners had told you? What do you wish your practitioner knew about support? So there's a lot of places where there's text box. And we hope that you fill the box and let us know your stories and share with us everything that needs to be included in this. So we'll send this out through My Gut Feeling, Debbie Stream Foundation, the International Gastric Cancer Association. Also strong work by the Manitoba team, Dr. Kadane, who's a thoracic surgeon there, and Elena Elamova, who is at Princess Margaret, and of course Katie's on this objective. And I think we're very close to getting this finished. We just met yesterday. The third thing we're going to do is a modified Delphi process, and that's to bring together experts, and it's going to be based on the survey. This is going to be the basis for the guidelines, and guidelines are really important. And so we saw that there's guidelines that are for cancer care. There's no guidelines that are specific for gastric cancer care. The International Gastric Cancer Association is quite interested in this as well, so we'll be collaborating with them. But this allows us to make statements, and when we have statements that are endorsed by a wide variety of experts, as well as a review of the literature, then we can make statements to Cancer Care Ontario, like everyone who has a gastric cancer diagnosis should see a dietitian, which is different than dietitians are nice people to have around. That leads to funding, and so then funding flows to the cancer centers, and the support is there. And that has happened in other areas, like head and neck cancer, for example. It's now stated that every head and neck cancer patient who comes through a cancer center in Ontario gets a speech-language pathology assessment, because that's what's really important to them. For gastric cancer patients, for pancreas cancer patients, a lot of other things I deal with, a dietitian is really important. And it's not always as easily available as it should be. So when we make these statements, we're thinking of what happens next and what happens to funding. If you're thinking in the United States, insurance follows that. So this is why we are taking the steps that we're taking. Christine Bresden-Maisley is our clinician lead, and Belinda Lane is our patient lead on this.
The next objective is a population-based analysis, and in Ontario, Ontario collects large health administrative data, and what's really cool about this is that we could use this data to analyze healthcare utilizations and generally what's the general health of the population or certain patient cohorts. And so for this objective, our goal is to evaluate the quality of management of anemia and nutrition, as well as patient-reported outcomes in patients undergoing gastrectomy and other types of treatments such as chemotherapy or radiation. And so we're looking into the data and seeing what types of nutrition-related testing are patients really receiving. So, for example, one of the aspects that we're looking into would be iron-related testing, whether or not patients are receiving those prior to or after gastrectomy. Another aspect that we're looking into is micronutrient deficiencies and just really establishing the baseline levels of vitamin B12, iron, certain levels of micronutrients that will be identified through our scoping review before and after treatment. And lastly, we'll be looking into certain nutrition-related interventions. Again, looking into how many patients are receiving blood transfusions or how many patients are receiving intravenous iron therapy. And so this project is going to be led by Dr. Coburn, myself, and our patient lead, Leanne Mandla.
The next part is something that we were actually already working on. It fits so nicely with the grant that we embedded it. And I think Denise was discussing malnutrition, and malnutrition is something, it's hard to measure, and it's hard to know patient to patient, the variation. And so when you say 85% of patients have malnutrition, that's a wide range, and there's multiple different ways to measure it. The best way to measure these things is prospectively. So to have an assessment within a database of malnutrition is much easier for us to analyze than trying to look at ICES data or data across the province. And in fact, many of those variables do not exist in any large database anywhere worldwide. So this is work that's out of the University of Alberta. It's led by Dan Schiller, who is one of the surgical oncologists out there. And we had started a Canadian gastric cancer database. We launched this during the pandemic. This has been a challenging thing to pull together different hospitals because of different regulations across the provinces. So the grant has money in it to help catalyze this and move it forward. And Teresa is the patient advocate on this part of the grant.
Okay, so the next two objectives, they go hand in hand. This is to develop patient and provider education resources to really help disseminate the nutrition guidelines that we'll be hoping to create. And lastly, we wanted to engage in integrated knowledge translations with leading patient advocacy groups such as My Gut Feeling, BC Cancer, and also the Canadian Gastric Cancer Association, as well as the International Gastric Cancer Association. And this is currently led by our team in Nova Scotia. So Dr. Stephanie Snow is a medical oncologist in Nova Scotia. Dr. Howard Lim is also a medical oncologist in British Columbia. There's also Teresa and myself.
They're getting a break for a while. So this is the overall framework. So we're starting with the review. We'll be asking the questionnaire very shortly, and everything is around patient engagement. We will be reporting back to you with all of our findings. They may come in a form of a presentation here over the next few years, or Teresa may be sending them out into emails to you. And then as we get some of the data back from ICES, that's going to inform how we build a better healthcare system here in Ontario and across Canada. So it's a 5-year grant. I think we've got everything, obviously, except for the end part of it with the educational resources. Those will flow later. But all of the groups are off and running. And really want to thank everyone for their support and for advocating to the Canadian Cancer Society, for them for funding, and for Teresa for herding cats as usual, telling all of us to get together and get our projects moving.
Yeah, so overall, this project aims to develop evidence-based guidelines and education resources for both patients and providers. And one thing I really want to highlight, again, with what Dr. Coburn was saying, is that this truly is a project made from a trans-Canadian team with multiple teams across the provinces of both healthcare professionals and patient advocates. As you can see, each objective has both a clinical lead and also a patient lead together with each objective to truly truly create research that is meaningful and important to gastric cancer patients. And so we're really looking forward to seeing what our research will lead to, and hopefully maybe we could, next year, we'll be able to talk more about our findings of this research. And if you're interested in participating, please stay tuned for our upcoming survey, and we'll most likely disseminate this through my gut feeling and other patient advocacy groups. And so thank you all for listening, and we'd be happy to answer any questions later.